Welcome to the channel. This is Getting Understanding with Dr. Daryl Ellis. The purpose and the focus of this whole YouTube channel is to help people to understand a little bit more about their health, how they can participate in their health care, how they can take better care of themselves and not have to rely so much on the healthcare system to be able to make sure that they're doing the best they can with respect to their physical well-being. It's very important that you understand that. This is an educational channel, and the best way for me to be able to put forth the information that you want to hear that'll be most beneficial for you is for you to interact with me. Let me know a little bit about what your situation might be, what kind of things you're struggling with, what questions you may have, particularly if you're not getting the results that you desire, to try and help you to become the best version of you that you can be as it pertains to both your physical and your emotional health. At our last video, we put out a video about hypertension. Got a lot of positive feedback about that. But one of the things that I did get in the channel was a question regarding diabetes. And they would like to get some additional information on that, particularly as it pertains to things they can do to help to better control their diabetes and or prevent diabetes if they have a positive family history of diabetes. That's what we're going to focus on today. If you hear something that appeals to you, if you think that there's more information that you want, let us know. Get in there, put in some comments so that we can develop the kind of content that best meets your needs. Also, be sure that at the end of the video, or even during the middle of the video, hit the like button if you like the content. Make sure you hit that bell notification and subscribe to the channel so that you can be among the first to be able to get the information that we're putting out. And hopefully, it'll be exactly what it is that you're looking for. Let's talk about diabetes. There are two different types of diabetes, type 1 and type 2. Type 1 used to be called juvenile type diabetes. We no longer use that nomenclature anymore because there are adults who present with type 1 diabetes. What's the difference? In type 1 diabetes, your pancreas, which is the organ in your body that produces insulin, does not function. And as a result, you don't have the production of insulin necessary to metabolize glucose and carbohydrates. As a result, you are by definition an insulin-dependent diabetic. You have to be on insulin. The type of diabetes that we see more often, however, is type 2. Type 2, or what we call insulin-resistant diabetes. It isn't as a matter of not being able to produce insulin, at least not in the very beginning, but more so as a result of the fact that your tissues, particularly your muscle tissues, have lost the ability to effectively utilize the insulin to help to metabolize the glucose and drive glucose into the muscles where it can be utilized for energy production at the cellular level. Well, it's a multifactorial cascade of events that lead to type 2 diabetes. The first step, like with hypertension, is a genetic predisposition. If you've got a family history of diabetes, particularly late onset or adult onset diabetes associated with excess body weight, particularly abdominal body weight, then you're in a high risk category to develop it yourself. How can you prevent it? If you've got the genetics, which you can't do anything about, there are certain things that you can do, certain steps you can take to try and prevent that genetic predisposition from manifesting in you. First of all, diet. You've got to try and stay away from a lot of concentrated sweets in your diet. You need to make sure that a part of that is limiting the carbohydrate intake. Well, what are carbohydrates? Breads, rice, pastas, potatoes, those are all forms of carbohydrate. And what carbohydrates are really just complex sugars. They're starches. They're a bunch of sugar molecules all attached together. And when they're introduced into your body, your liver breaks those down and turns them into sugar. And then that becomes circulating glucose in your blood, which under ordinary circumstances is used as a source of energy for the cells in your body. However, if you have been participating in high sugar, high carbohydrate diet and have not been exercising to the point where you're burning off those sugars adequately, those sugars begin to introduce into you more and more what we call abdominal or intra-abdominal fat. That intra-abdominal fat usually produces an increased waist circumference, and it's more than just an aesthetic problem when you go to the pool. Those intra-abdominal fat cells actually are hormonally active. They secrete what we call inflammatory humors in your blood, humors that will go to your tissues and produce chemical reactions which downgrade the receptors on your tissues, which enable insulin to enter into the tissues and help to absorb and metabolize glucose. So as a result of that, your serum insulin levels, which are still being produced by your pancreas, go up and up and up. Well, unfortunately, insulin does more than just help you metabolize glucose. It's actually an inflammatory hormone. So it causes additional inflammation in your body, which further potentiates the insulin resistance that started the cascade in the first place. As you become less and less effective at utilizing your insulin, those sugar levels start to go up and up in your bloodstream. And that's how you end up tipping over from normal glycemic to pre-diabetic and then subsequently diabetic. So again, how do we prevent that? Watch the diet and make sure you're getting regular daily exercise. Regular daily exercise does a number of different things for you. Number one, it helps stimulate the use of the glucose and the insulin at the level of the muscles. The more you use the muscles, the more the muscles require sugar, and the more efficiently they then metabolize that sugar, preventing some of that insulin resistance from occurring in the first place. Number two, by exercising regularly, you're burning calories more efficiently, decreasing the risk that you're going to increase the amount of abdominal fat that's produced, and therefore also decrease your risk of the insulin resistance that can lead to the diabetes. So those are the two things that you can do. The other thing that you can do is make sure that you're going to your healthcare provider regularly, getting yearly examinations. If you've got an increased risk for diabetes, it's something that needs to be monitored, because in some cases, no matter how careful you are, no matter how well you continue to exercise, that genetic predisposition may already be unlocked, and you may be on your way to developing diabetes, even though you're doing everything that you need to do. And in some cases, that requires the introduction of medications to try and decrease your risk of progressing from pre-diabetes to diabetes, or if you're already diabetic, keeping that progression of newly onset diabetes to diabetes that is out of control, leading to organ system damage. So these are the things that you can do preventatively. There are also certain, if you will, supplements that you can take that can help decrease your glucose levels. Number one, and it sounds kind of funny, but cinnamon. Cinnamon is a great additive. It's a spice that they actually even sell in the form of tablets in most health food stores that helps you with your glucose metabolism, decreasing those serum glucose levels and actually helping to prevent and improve some of that insulin resistance that may have already developed in your body. So cinnamon is one. There are other things that you can do in terms of supplements, making sure you're on a regular multivitamin, which helps stimulate that cellular metabolism and help those cells in your body work more efficiently. Multivitamins, cinnamon supplements. Some people say glucosamine can help with your glucose metabolism, but it really doesn't. The other thing that you can do, in addition to going to your doctor on a regular basis, is making sure that if you develop any symptoms that might indicate that you're developing diabetes, that you seek medical attention immediately. What are those symptoms? Blurry vision, noticing that if you have a wound or if you have a cut, that it takes a long time for those wounds to heal, more so than it probably used to when you were younger. If you develop excessive thirst, if you develop frequent urination, excessive fatigue, all of those are symptoms of hyperglycemia and or diabetes. If you have those symptoms, seek medical attention to make sure that you get the proper diagnosis and get the proper treatment before you end up with serious abnormal effects on your organ systems.